Stroke is a medical emergency. It demands immediate attention. As a general practitioner, you are on the front lines. You play a critical role in recognizing, diagnosing, and managing stroke. Your early intervention can significantly impact a patient's outcome. We must be prepared. Strokes occur when blood flow to the brain is disrupted. This disruption deprives brain cells of oxygen. Without oxygen, brain cells begin to die. This can lead to lasting brain damage, disability, and even death. Time is brain. This phrase underscores the urgency in stroke management. The faster a stroke is recognized and treated, the better the chances of minimizing brain damage. Our role as general practitioners is multifaceted. We are often the first point of contact for patients experiencing stroke symptoms. We must be vigilant in identifying these symptoms and initiating prompt action.
Ischemic stroke is the most common type of stroke. It occurs when a blood vessel supplying the brain becomes blocked. This blockage prevents blood flow, leading to brain cell damage. Two main subtypes of ischemic stroke exist: thrombosis and embolism. Thrombotic stroke happens when a blood clot forms within an artery directly supplying the brain. This clot, called a thrombus, typically arises from a buildup of plaque in the artery. This buildup narrows the artery, making it prone to clot formation. Embolic stroke, on the other hand, involves a blood clot that travels from another part of the body to the brain. This traveling clot, known as an embolus, often originates in the heart. The embolus travels through the bloodstream until it lodges in a brain artery, obstructing blood flow. Understanding the distinction between thrombotic and embolic stroke is crucial. It guides treatment decisions. For instance, medications that break down blood clots may be more effective in embolic stroke.
Hemorrhagic stroke is less common than ischemic stroke, but often more deadly. It occurs when a blood vessel in the brain ruptures, causing bleeding within or around the brain. This bleeding compresses brain tissue, leading to damage. Hemorrhagic stroke has two main subtypes: intracerebral and subarachnoid hemorrhage. Intracerebral hemorrhage happens when a blood vessel within the brain bursts. The blood leaks into the surrounding brain tissue, causing damage. This type of stroke is often associated with high blood pressure, which weakens blood vessels over time. Subarachnoid hemorrhage, on the other hand, involves bleeding into the space between the brain and the skull. This space, called the subarachnoid space, is normally filled with cerebrospinal fluid. The bleeding in this area often results from a ruptured aneurysm, a weak or bulging spot on a blood vessel. The location and extent of bleeding determine the severity of a hemorrhagic stroke. Prompt diagnosis and treatment are crucial to control bleeding and minimize brain damage.
A transient ischemic attack, or TIA, is often called the mini-stroke. It shares similar symptoms with a stroke, but the symptoms are temporary and resolve within minutes to hours. However, a TIA should never be ignored. It's a serious warning sign of an impending stroke. A TIA occurs when blood flow to the brain is temporarily blocked. This blockage is usually due to a small blood clot that dissolves on its own. Although symptoms resolve quickly, a TIA indicates an increased risk of having a full-blown stroke in the near future. Recognizing and addressing the underlying causes of TIA is crucial. Lifestyle modifications and medications can help reduce the risk of a subsequent stroke. Patient education plays a vital role in emphasizing the seriousness of TIA and the importance of seeking immediate medical attention.
Section 5. Recognizing the symptoms of stroke. Stroke symptoms often appear suddenly and without warning. Recognizing these symptoms is critical for prompt action. The most common symptoms can be remembered with the acronym FAST. One side of the face may droop or become numb. Ask the person to smile. Is the smile uneven? One arm may become weak or numb. Ask the person to raise both arms. Does one arm drift downward? Speech may be slurred, or the person may have trouble speaking or understanding speech. Ask the person to repeat a simple sentence. Is the sentence repeated correctly? If any of these symptoms are present, even if they are fleeting, call 911 immediately. Time is of the essence in stroke treatment. Other symptoms may include sudden confusion, trouble seeing in one or both eyes, dizziness, loss of balance, and a severe headache. It's essential to remember that stroke symptoms can vary from person to person.
Section 6. Fast response. Timely action saves lives. The FAST acronym serves as a quick assessment tool for stroke. However, it's equally important to emphasize the urgency of seeking immediate medical attention if any stroke symptoms are suspected. Time is brain. Every minute counts. The faster a stroke is diagnosed and treated, the better the chances of minimizing brain damage. Delays in treatment can lead to irreversible brain damage, long-term disability, or even death. If you suspect someone is having a stroke, don't hesitate. Call 911 or your local emergency number immediately. Even if the symptoms seem to be improving, it's crucial to seek medical attention. A stroke is a medical emergency that requires prompt and specialized care.
Section 7. Diagnostic Tools, Unveiling the Stroke Subtype. Diagnosing a stroke quickly and accurately is essential for determining the most appropriate treatment. Several diagnostic procedures play a crucial role in this process. A CT scan of the head is often the first imaging test performed. It helps differentiate between ischemic and hemorrhagic stroke. This distinction is critical as treatments for each type differ significantly. An MRI provides a more detailed image of the brain. It can detect smaller strokes and those in areas not well visualized on a CT scan. MRI can also help assess the extent of brain damage. This test uses sound waves to create images of the carotid arteries in the neck. It helps identify any narrowing or blockages that may have caused the stroke. An echocardiogram uses sound waves to create images of the heart. It can detect blood clots in the heart that may have traveled to the brain, causing a stroke. Various blood tests can help rule out other conditions that may mimic stroke symptoms. These tests also provide information about the patient's overall health and help guide treatment decisions.
Section 8. Tailored treatment addressing the specific stroke. Stroke treatment depends on the type of stroke, its location, and the extent of brain damage. Timely treatment is crucial for improving outcomes. These clot-busting medications help dissolve blood clots. They are most effective when administered within a few hours of symptom onset. This minimally invasive procedure involves using a catheter to remove a blood clot from a blocked artery in the brain. It's typically used for larger clots that don't respond to thrombolytics. Medications may be used to control blood pressure, prevent seizures, and reduce brain swelling. In some cases, surgery may be necessary to repair a ruptured blood vessel, relieve pressure on the brain, or drain blood from the brain. These medications, such as aspirin, help prevent blood clot formation. These medications, such as warfarin, prevent existing blood clots from growing and new clots from forming. Beyond these specific treatments, managing risk factors like high blood pressure, high cholesterol, and diabetes is crucial in preventing future strokes.
Section 9. Life after stroke, the road to recovery. Stroke recovery is an ongoing process. It varies depending on the severity of the stroke and the areas of the brain affected. Rehabilitation plays a vital role in maximizing recovery and improving quality of life. Helps regain strength, coordination, and mobility. Assists in relearning everyday tasks, such as dressing, bathing, and cooking. Addresses difficulties with speech, language, and swallowing. Ensures proper nutrition and hydration, especially for those with swallowing difficulties. Provides emotional support and coping strategies for patients and their families. The journey after a stroke can be challenging. However, with comprehensive rehabilitation and ongoing support, individuals can make significant strides in their recovery.